Welcome back to Little Growing Bones. So today we'll be talking about how to take care of amputation stumps in children, what every parent should know. Hi there. If your child has had an amputation, whether due to a birth condition, whether it's secondary to trauma, infection, or surgery, you might be wondering, and you might have multiple questions like, how do I take care of the stump? Why does it hurt sometimes? And what happens if the stump changes as they grow? So today we'll gently walk through a few of these things, and this will include what an amputation stump is, why amputations are done in children, or why amputations happen in children, why stumps sometimes get painful, why stumps sometimes hurt, how to investigate and treat these injuries, and when revision surgery may be needed. So let's begin. What is an amputation stump? An amputation stump is what's left behind of the limb after a part of it has been surgically removed. In children, the skin, muscles, and bones heal and reshape over time to form the end of the limb, what we call the residual limb or the stump. So this stump needs special care because children are still growing and their bodies are constantly changing. Why are amputations done in children? Amputations in children can happen because of several reasons. One is congenital limb differences. So this is where part of the limb didn't develop fully or at all in the womb. We've talked about this for conditions like tibia hemimelia and fibula hemimelia. In some of these cases, an amputation is warranted to better the function of the child. Amputations can also occur secondary to severe infection. So in things like gangrene or sepsis of an infected limb. They can follow trauma, so from road accidents, burns, of injuries. This can also be done if a limb has a malignant tumor, so where the limb must be removed to save the life, an amputation is done. Amputations can also be done for circulatory issues, so in rare conditions that affect blood flow, amputations can be done. So regardless of the cause, what matters most is how we support the child and family after the amputation has been done. Why do amputation stumps hurt sometimes? Some children may feel pain, discomfort, or even sensitivity in the stump, especially as they grow. This can be due to one, neuroma formation, so a bundle of nerves at the stump, a bundle of nerves at the stump end that become very sensitive can lead to pain. This is what we call a neuroma. It can be because of phantom limb, so where the child feels pain in the part that was removed. It can also be because of bone overgrowth. So a very common issue in growing children where the bone continues to grow past the soft tissue, causing sharpness and pain. It can follow poor fitting prosthetics. So if the prosthesis rubs or presses really hard into the skin, it can lead to pain. It can also be because of infection or skin irritation. What are the symptoms to watch out for? So I'll list a few of these. These are: one, pain or sharp discomfort in the stump. Two is redness, swelling, or sores. Also, your child avoiding wearing the process is a red flag. A visible bump or sharp angulation at the end of the stump is also something to watch out for. In some cases, it could go extreme and they have actually a bone exposed through the stump. Or sometimes it can be signs of infection, like if there is pus that is oozing out of the stump, or if that area is warmer than the other side, and if your child is running a fever. These are all important signs that need attention. How do we investigate stump problems? We will have typically taken a history and noted concerns about the stump. So we'll do a physical examination to check for tenderness, skin breakdown, or bone sharpness. X-rays are sometimes done to look for bone overgrowth or abnormal angulations. In some cases, we get ultrasounds and MRI scans to detect for like nerve problems or soft tissue problems, or even hidden infections. So talk to your child about what they feel, especially if the phantom pain is suspected. How do we treat stump pain or stump problems really? So here's the good news: most stump problems can be managed effectively. This is depending on the issue. The treatments may include one, giving medication or nerve blocks, medication particularly to block off nerve-related issues. Physical therapy is important. It can help reduce stiffness, especially if it's in proximity to the joint. It can also be used for phantom pain. Stump massages and desensitization therapies are also very helpful. Sometimes you have to refit the prosthesis to improve the comfort, and in some incidences surgery is needed. So surgery is needed especially if the bone has grown too far or the stump shape needs to be corrected. Now let's go over something important. What is revision surgery when talking about amputation stumps? So a revision surgery is a follow-up operation to reshape or adjust the stump. Children often need this as they grow, especially if the bone grows too long or it's just too sharp at the lower end. If they do have a neuroma, this may have to be looked into as well. If the stump becomes painful or it's hard to fit into the prosthesis, if the skin breaks down or doesn't heal properly. During the revision surgery, the surgeon may trim the overgrown bone or reshape the soft tissues or remove the nerve bundle that's causing pain to reduce pain and improve the function. With the right care, children with amputations do amazingly well. They adapt quickly, they learn to use the prosthesis with confidence, and they can run, play, draw, dance, like live a full life. They're able to build strength and independence and resilience. So support from a multidisciplinary team, including the surgeons, the therapists, the pediatrician, psychologists, prosthetists, and the parent makes such a difference for these children. As we conclude, an amputation stump is the healed end of the limb after the removal of a limb, of part of the limb. Pain may come from nerves, bone overgrowth, prosthetics use, and other skin issues. We typically examine them and sometimes get imaging to further understand what's causing the pain. The treatment includes therapy, medication, and sometimes revision surgery to try and alleviate these symptoms. Most children recover really well, they adapt beautifully, and they're able to thrive. So if your child is living with an amputation, remember, they are not broken. They are growing, they are adapting, and they are becoming stronger every day. So your love and support and attention to their needs is the foundation to their healing. If you found this video helpful, give it a thumbs up. Don't forget to share and subscribe, and share this to empower more families and to let them know about these conditions. And you're not alone on this journey, and neither is your child. So until next time, keep it on little growing bones.